Maybe don't know.
This time, next time, this time to build. 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 This time power. This time to build power. This time to build power. This time to build power.
What's up, everybody? I'm your host, Chris Hampton. Welcome to episode 153 of the Power Company Podcast, brought to you by PowerCompanyClimbing.com. I am still here in Lander, Wyoming, where the snow has decided that it is here to stay, at least for a little while. We are currently getting dumped on, which has forced me into the gym and away from the outdoors right now, which honestly is perfectly fine. I feel like I'm in need of a good training cycle, and it was that time. So I'm kind of excited to not be tempted by those outdoor boulders. Of course, first sunny day, I'm going to go out and shovel some boulders out. But, you know, that's how this thing goes. As of right now, this is our biggest month ever for the podcast, which after just reaching the 1 million download mark is crazy. The thing just keeps growing. Thank you, everybody out there. A couple of quick notes. The submissions for the Red River Pump Prep Scholarship ended today. Drew and I have quite a few to go through. I'm really excited about the number of people who applied, the diverse amount of people who applied. So thank you, everybody who got that into the hands of people who really need it and are underrepresented in this community. I appreciate it, and I'm really looking forward to, and a little nervous, to be honest, looking through all of those applications. We'll be announcing the winner on Friday, which is Black Friday, and that is also when the pump prep registration will open. And it's Black Friday. Everybody expects sales and all this. We don't really do many sales here unless it's apparel that we're phasing out and getting rid of, something like that. Instead, we just try to keep our prices as low as we can and still operate. So what we will be doing is releasing, they've already been trickling out. We just haven't announced it yet. We'll be updating all of our proven plans and adding a few more. I'll tell you more about those in another episode, but just be aware that all of those proven plans that are on the website right now are brand new, updated programming, updated exercises, new videos, new instructions. We're trying to make it the best possible experience for all of you who want to train with us. So check those out. No sale, but you're getting a better value. So essentially, you're saving money. Another interesting thing that I want to chat about really quickly is if you happen to know a climber who's looking for a change of scenery, who has some restaurant experience, local climber-owned restaurant, The Cowfish, is hiring for a general manager. The owner is a climber. A lot of the staff are climbers. A lot of them climb here at the machine shop. So it's a really great crew. Tons of climbers. He understands climbing schedules. And if you're a climber with restaurant experience, you can find a link in the show notes to apply for that job here in Lander, Wyoming. And we can be neighbors. Or if you have a friend, send them that way. All right, that's enough of my yapping. Let's get on with this thing. Today's guest is Dr. Natasha Barnes, and Natasha is someone that you're probably already familiar with. If you're not, she was a celebrated competition climber and boulderer who ultimately became a chiropractic doctor and a PT, and currently is really focused on the rehab and strength training of rock climbers. And something that I really appreciate about Natasha's approach is that she wants to give climbers the tools to rehab themselves down the road and to understand their injuries better, their rehab better. And one of the things that has to be addressed in that setting is pain. And honestly, as a coach, that's something that I feel underprepared for a lot of the time. It's a gauge that we use pretty constantly, and it's a faulty gauge most of the time at best. So this is a really interesting conversation about pain science and how we react to it, how we experience it, and some actionable information on how you can assess and react to pain in a more positive, empowering sort of a way. So let's get into it.
And so when people are getting pain from injuries that's longer than 3 months, it's usually not an issue with the tissue. It's a protective mechanism of the brain.
This time to build power. This time to build power. This time to build power.
He's retired, but he's still working on everybody's electronics. He does electronic work. He's got this shop filled with electronics.
You gotta have your thing, man.
Yeah, he's hilarious. He's awesome.
That's awesome.
But yeah, so you just showed us this video. Like we came up. First off, thanks for having us in your office.
Yeah.
I appreciate it hugely. And you just showed us this great video that talks about pain science and how the brain reacts to stimulus, and decides that it's pain or decides that it's not pain, whichever. And this is something I've seen you talk about quite a bit in the recent past, and I think is a fascinating topic that climbers should be hearing more about, especially as training and coaching becomes more popular. You're going to encounter some things that your brain is telling you shouldn't be doing. Mm-hmm. Your brain's going to say it's painful, it hurts, you shouldn't do that. And a lot of people listen to that automatically. And Nate and I, as coaches, are always getting messages like, oh, I felt this in my elbow, I'm going to take 3 weeks off. And I'm like, oh no, your brain's telling you the wrong thing. But I want to dig into that a little bit with you. You work in this rehab setting, and I'm sure you deal with it far more than we deal with it. So I'm curious how you talk to your clients and your patients, and I mean, we just want to know, basically this is a selfish thing. We want to know better how to talk to people. And I think it's just a really fascinating subject to begin with. How did you get into dealing with pain science?
It is really fascinating. The way that they don't really teach it in school. That's not something, they teach you a little bit about pain, like really, really basic stuff, but they don't get into modern pain science. And so the reason that I learned about it is because I have had some of my own like funny chronic pain issues that I've had to like learn about and deal with. And then obviously through work too.
Are these things that were from way back when you were climbing a lot and, pre becoming a chiropractor and being in the rehab?
Yeah.
Okay.
So I mean that was my whole the impetus for doing what I do now is being a professional climber, suffering from like multiple climbing injuries,
right.
Like pulley injuries, multiple pulley injuries, and also like multiple shoulder injuries. and a couple of other little things that weren't as major.
Yep.
And not having a clear answer of like what I could do about them, because especially back when I started climbing, there weren't any rehab professionals or doctors who really worked with climbers.
Right,
you know?
for sure.
It definitely was like a fringe sport, like even more than it is now.
Mm-hmm.
And so I was really motivated to learn how I could help not only myself, but like also help other climbers like deal with pain, because you know the answer is like, whoa, you rock climb, that's weird, just stop doing that, that sounds really dangerous.
Yeah, for sure.
And you know, if you're anything like us, it's like, yeah, we're not gonna stop climbing.
Yeah, that's not an invalid answer. It's not gonna happen.
That's not an answer. Like, I'm gonna keep having pain and climbing because I'm not going to stop. So there must be another way. So that's why I went to school for this. And I've had my own pain experiences, and more recently with powerlifting, because now I compete in powerlifting and I train for powerlifting. I've had like some low back pain, and I've had persistent low back pain that didn't make any sense. And I knew a little bit about, obviously, because I was already rehabbing athletes, I knew a little bit about that, but I had to learn a lot more about that because I was having pain that didn't make sense. Like, you know, bending over to pick something up and my back would go out. Like, that doesn't make sense. Like that, something like that.
Yeah, I mean, you're picking up hundreds and hundreds of pounds, so bending over to pick up that envelope you dropped. Exactly.
Like, that shouldn't be causing a tissue injury.
Right.
And so it was really valuable to like learn a little bit more about like how pain works. And learning how pain works for a lot of my patients is actually just learning how pain works. Like that video that we watched, that is a medically recognized form of treatment. Right. Like, that is something that can, just learning how pain works can decrease somebody's pain.
Yeah. And I will, you know, just so everyone listening knows right off the bat, I will have links to this video. It's Lorimer Moseley.
Yes.
TED Talk from Lorimer Moseley. He's hilarious. It's a really fantastic video and a really easy watch. So I'll have links to that in the show notes right there in your pocket supercomputers. So just so everybody knows already.
So, you know, pain is really, really complex, and it's interesting, and it's different for everybody. And, you know, the really complicated stuff around persistent pain doesn't apply to every injury either, you know? Like, if you fall off a boulder and twist your ankle, like, that's pretty straightforward. There's some tissue damage going on there.
Sure.
That's something that's acute that needs to be dealt with. But for some people, they can have persistent pain. And I've seen that with a lot of climbers. I've seen it with climbers who have like neck pain, even climbers
Which
who have...
I have right now, actually.
Oh, yeah. Climbers who have, well, this will be good for you maybe. Climbers who have like shoulder pain that seems really mechanical and really, really related to climbing, but they've had it for long enough and it's been off and on, and it's very clear that like it's not a tissue issue anymore.
How is it clear that it's not a tissue issue?
Most soft tissue injuries are going to be healed within like 3 to 6 months at the most.
Okay.
And some people can have persistent issues for longer than that. And
even if you're like still doing the thing that you think caused the injury, it'll still remodel in some way.
It can adapt, yeah. You know, I mean, obviously you're not doing the same thing, all the same exact intensity thing that caused the injury, but yeah. And depending on where you look, some sources will say 6 weeks. Like if you break your femur, which is the biggest bone in your body. I have
broken my femur.
That fracture will heal in 6 weeks. And so a lot of times when people have these injuries and they have persistent pain, so persistent pain or chronic pain is considered any pain that's been going on for longer than 3 months.
Okay.
Because most things are generally healed by then, or healed as well as they're going to be.
Yeah.
And so when people are getting pain from injuries that's longer than 3 months, it's usually not an issue with the tissue. It's something else. It's a protective mechanism of the brain. And the brain is giving them pain because it wants them to protect that area.
Yeah. So let's say that person who's had this chronic thing going on for 3 months, 6 months, whatever, can their brain limit their performance due to this thing, even if they're trying to push through. You know, they think they're the most mentally strong climber on earth and they think their pain tolerance is amazing. Can their brain still say, we're going to throttle your performance down because you're freaking us out a little bit and we think this thing is going to hurt you?
Yeah, absolutely. I mean, there's definitely people who can override pain signals and like push through things that are painful. Like there's climbers who can climb through injuries. There's power lifters who can, lift world records through injuries, and that happens
through
all the
major
time.
Injuries, sure.
But there is research that shows that even though they're able to do that, like their brain is trying to stop them from doing that. And they've done research on it where they've done like saline injections in the quad, which is supposed to be like a painful stimulus, and the quadriceps cannot contract as hard as it can when they don't do that, or as it is on the other side.
Right.
So yeah, your brain can inhibit like how well you're able to use a part of your body if there's pain there, because it's trying to protect you. It can also inhibit your range of motion and all kinds of things like that too, to try to protect you.
Right. So if you have this pain and you think, I'm hurt, I'm injured, I know that because I'm not as strong, that's not a good indicator that you actually are injured, because it could just be your brain saying, we're not going to let you be as strong in this position or during this sort of move or whatever because we think it's dangerous.
Mm-hmm. Yeah, it's not always because of an injury. Like sometimes it is, and usually there's pain involved around that, or like apprehension or something around that. But yeah, that can happen.
Yeah, and I'm probably going to continue to struggle with the language of all this. So keep correcting me if I'm saying things like injury when there's not actually an injury, you know, and that's exactly what I mean. So when we are feeling that pain, first off, before I go there, let's talk about how this actually works. And we don't need to go into like the super details. I think they can go to Lorimer Mosley's TED Talk and he lays it out pretty well.
But give you some other links too for people if they want to read further.
Yeah, that'd be perfect. And so why is it that we shouldn't always be listening to our pain mechanism?
Well, pain isn't always a good indication of tissue damage.
But that's what we've been taught. Like that's
100%.
What we've learned since we were kids. Like if it hurts, move your hand. Like don't do it.
Yep. That's definitely, and it's natural. Like it's not anybody's fault. That makes sense, you know?
Yeah.
And it's a model that's been around since like the 1600s.
Sure.
And
I mean, really, since probably the beginning of humankind. Like if it hurts, stop.
Yeah, and that's the point. Like your body wants you to stop.
It's a biological mechanism to keep us safe.
Yeah, but recently we've learned that that's not always something that you need to listen to. And there's ways to tell, like if it's something you should listen to or not. But a lot of times pain isn't going to be a good indication of tissue damage. And there's a good example of that. Like an example would be like a soldier in battle who gets shot but is carrying his buddy out of battle. Like he's not going to feel that wound. Right. Because he's busy trying to get to safety and get his buddy to safety. He's definitely going to feel it later.
His brain's fight or flight has overridden that gunshot.
Something else is more important.
You need to get the fuck out of here. We don't care. This gunshot is minor compared to the fact that you need to get out of this situation.
Exactly. Yeah. Whereas you could be at work and get a paper cut and it's like the most painful thing you've ever experienced.
Paper cuts do suck. Let's be honest.
Or like another example is like, you know, stepping on a Lego. Like that somebody ever.
God, how do you come up with the two worst things on earth? That sounds horrible.
Stepping on a Lego hurts. But if there was a lion chasing you, like, would you care about stepping on a Lego? Or like you're in Africa, you step on a rock, but there's a lion chasing you. Are you going to feel that? No.
Yeah, true.
You're trying to get out of there.
Yeah.
And, you know, there may be very real tissue damage with that. You know, some tissue got injured when you stepped on it, but that's not a priority.
Right. You're not going to feel it at that moment.
Yeah. And so that's a good example of like how pain isn't always a good indication of tissue damage.
Yeah. And the inverse of that is true as well. Like, essentially, if you've hurt yourself this way in the past and your brain doesn't want to do that again, when you do that same movement, it might be really hard to overcome it without feeling pain, because your brain's saying, whoa, we don't like that, Gaston. You hurt yourself in that position before.
Right.
Don't do that again. We're going to send a pain signal down there and say, don't grab that hold.
Right. And it's trying to protect you. And that may not be something that you need protection on. And in fact, that can be a bad thing, because you're training your body that this position is dangerous and this position isn't a position your body should be in. And that's not always true. And there's ways to, and for some people, they really can't get into certain positions because it does hurt. And, that can make the pain worse if they get into that position, because it's very threatening to the body. And so there's ways to get around that by graded exposure. Like, for example, this isn't a rock climbing example, but I had a patient this week who's a power lifter, and she did something to her knee. We ruled out red flags. It didn't seem like it was anything super major, but her knee was swollen and she couldn't squat all the way down because of the swelling and pain. And so instead of just like forcing her to squat down and completely ignore the pain signal, because you can't do that either, you have to respect that a little bit, because otherwise your body's just going to give you more pain.
Sure.
We can do what's called graded exposure. So I had her start by squatting down to a high box, to a depth that she could without feeling the knee pain. And then we just progressed her lower and lower and lower over the session. And by the end of the session, she's squatting all the way down without pain.
Right.
Because we've sort of challenged the body's belief about that position. And it thinks that position is dangerous, but it's not. So if we play right on the edge of that and ease into that position, we can retrain that pain pattern. And the same thing happens, like that was an acute injury. The same thing we can do with like chronic pain. We can retrain that brain, that pain pattern.
Sure. Can an acute injury that your brain is convinced is an injury? I'm trying to get the language right here. I don't know. Can that become a chronic thing just because you never address it?
Yeah, that's how chronic pain starts. Like, people have had some kind of legitimate like tissue injury that started the whole thing off. And then for whatever reason, and it's multifactorial, it's super complex, and it depends on the person and their situation. For whatever reason, it becomes a chronic issue, and their pain system becomes more and more sensitive. And a lot of it has to do with like their beliefs around pain, their like social things around pain. Like, there's different cultures that view pain differently.
Sure.
That has a big thing to do about it.
I know a lot of people who are like, who want to act like they're in pain, because it's cool to push through or something.
Or you're a male soccer player and just saying.
I have never been a male soccer player.
Yeah, I mean, for example, whiplash, right? Like, if you get into a car accident here in the United States, when you go see the doctor, they're like, you may experience whiplash. That happens with car accidents, and they explain that to you. In, I think, what country is it? I think is it Latvia? Some Eastern European country. They literally don't have a word for whiplash.
Right.
And when you get in a car accident there, the doctor doesn't talk to you about whiplash. They don't have a word for it. It's not a concept there. And literally nobody experiences
So
whiplash.
they just don't have it.
They just don't have it.
Yeah.
And a lot of that, it's a cultural thing, They don't talk about it. They don't know about it. They don't think about it. So they don't experience it. And here in the United States, everybody knows what whiplash is.
Wow. Can we make a word for like being as strong as Alex Megos so that I can experience it? That'd be cool.
Yeah, visualization, right?
So I do have a climbing example of it, and I just want to very selfishly bring that up, and maybe we can use it as an example, and you can explain a little more of it. Years ago, I don't remember how many because I'm horrible with dates. Maybe 4 years ago, I had a shoulder surgery. supraspinatus repair and a bicep tenodesis. And then that shoulder is stronger than ever. I did, however, hear a recent podcast that talked about, even though it was a complete tear of the bicep tendon, I potentially could have just not done anything and only lost like 3 to 5% of strength or something like that, which is crazy to think about. But regardless of that, that shoulder is stronger now. But I tried campusing maybe a year and a half or 2 years after the surgery. And it was incredibly painful. Like this really sharp pain sent to me at like this really specific moment in the campusing. And it would be, I could do the first big move, totally fine, no problem. But so my surgery was on my right shoulder. If I made the first big move with my left hand, as soon as I went to release my right hand to do the next ladder, sharp pain sent to my shoulder. That's what it felt like. And at first, it was Nate and I. At first, I was like, oh, can't campus. That may be out forever. But then I started realizing if there was a move that felt that way, like a big move where I had to generate all this momentum with my right hand low, and I would be making a big move with my right hand, it would send that same pain signal. And I'm like, but I really want to do this move. Like, I don't give a shit about campusing, but I really want to do this move. So I would push through it. And by the third, fourth, fifth time I would try the move, no more pain. So just recently I started trying to campus again, immediately pain. And I'm like, it doesn't make sense because the same pain happened with this move. Then I was able to push through it. Now it's happening with this campusing. My shoulder doesn't know if my feet are on or not. It just knows I'm doing this big explosive move. So let's try and push through it. And sure enough, within a session, I was doing big campus moves with absolutely zero pain. And it was a really intense, sharp pain that made me like, I'm not fucking doing this move. Like I'm going to drop off instead of trying this. But totally gone in, within the course of 30 minutes of graded exposure, or what did you call it?
Yeah, graded exposure.
Graded exposure. It went away.
Yeah.
How do we know that that's what we should do? Are there tools we can use to say, okay, this is probably all in my head. This is my brain playing tricks with me or whatever. And I'm sure that's not the language you use, but or this is an actual injury.
Yeah, that's a good question.
How the hell do we know?
First of all, I want to say that pain is never just in your head. It's always real. And whenever you have pain, you're actually experiencing it.
See, I knew that wasn't the right language.
And, that's an important thing to point out, because a lot of times when people are learning about pain science, they're like, so you're telling me I'm imagining it. No, you're actually having pain.
My wife says this to me all the time. You're telling me I'm imagining it? Yeah.
No, your feelings are valid. Like, you're experiencing pain. And that's really, if you're a practitioner, that's an important thing to acknowledge with people too. Yes, I acknowledge that you're experiencing pain, and the pain is very real. But is it really something that we need to listen to? Like, are you actually in danger right now? And with your campus story, you did all the rehab for your shoulder. You may not have done something that ballistic or that high intensity with the shoulder. And so the shoulder was like, what's going on? We're not adapted to this. We don't like this. We're not sure. Okay, pain.
I did that stick you shake a lot. Was that not enough?
Not enough. That's not high intensity enough. Yeah.
What is it? Yeah, that might be it.
Right. Yeah, something like that. Yeah. And then in that situation, you're like, okay, my body's telling me something. Maybe I need to listen to that. Maybe I don't need to campus. Campusing has a bad reputation for hurting people. It's high intensity. Maybe I will just stop doing it.
Yeah.
And then you go to climb, and that situation's different. You're like, I really want to do this move.
Yeah, I place a lot of value on.
I want to send this climb. I want to to do the move. That's a whole different situation. Like you're in a little more of a positive mindset there because you want to do the move. And if you slowly expose your shoulder to that move and you just do it, you don't panic about it, and you're like, I can work through this, then you do, and you did. And then you went back to the campus board and had pain again because the campus board's high intensity. It's dangerous. And your shoulder's still not maybe. That's a situational.
And I just didn't care as much. Like,
yeah,
this
you didn't
isn't
care
as
about
important
it.
to me.
Right. And that's also a totally different like situation and context, and that stuff plays into people's pain too, like context.
Sure.
And maybe that move you weren't perceiving as dangerous, but the campus board you are because, whatever. We all climbers know people get injured campus boarding,
Yeah.
But then you worked through that too, and you were able to make that a non-threat, and you were able to start doing that. And so you weren't actually injuring yourself by putting yourself in that situation. It was just a situation that your shoulder maybe hadn't encountered since the surgery.
Yeah.
And it wasn't sure, and it seemed sort of dangerous, and so it was giving you pain to kind of protect you from getting injured. And so it can be hard to tell for people whether or not something is worth ignoring and pushing through, or if it's something that they need to take seriously. There are some things that people can do. If you're not sure, go see a practitioner, go see a physical therapist or a chiropractor or somebody who knows pain science, who can talk to you about this stuff and figure out if it's worth, if there's red flag symptoms and it's something you need to, because there are situations where like we need to be like, yeah, no, we shouldn't do that. But most of the time it's something where we can just slowly expose you to that position or that movement or that situation, and we can decrease that threat and we can decrease the pain over time. And so the thing that I tell people, like I have people who come in, climbers who come in with like finger injuries. Obviously that's a very real injury. But with any injury, like we need to stress the injured tissues if we want them to get better.
Right.
And for pulley injuries or even like with tendinopathies and stuff like that, it can be painful. Like you can have discomfort and a little bit of pain when you're going through that rehab process, and it can be scary for people. They're like, well, I'm just not going to do it then.
Sure.
And so it's important for them to know, and I explain this to them, like you're going to have some discomfort with this rehab process, and it's okay. And usually you can tell because the pain shouldn't spike too high during the session, and the pain level should return. Your pain or your discomfort should kind of return to baseline within like 24 to 48 hours. And if that happens, sweet. Like I've had people who come in that say, okay, well, it kind of hurts my finger to hang on the hangboard. And I'm like, well, how do you feel the next day? Fine. Well, actually maybe better, but sometimes just fine. And I'm like, okay, well, that's great. That's the perfect amount of stress. And I had to find that out the hard way. That was one of the first climbing injuries that I got. I got a really bad pulley injury. I think I may have I didn't actually get imaging on it, but it's possible that I actually fully ruptured my A2 on my ring finger, my middle finger of my right hand. It was in the old PCA days. I don't know if you remember.
Yeah.
PCA.
Oh, yeah, for sure. I remember. I'm old, Natasha.
We're all old here. I was competing there. I think I got third place at that competition, at that particular competition. And after the competition, my finger was sore. And they were having a dyno comp after. So I was like, well, it's just a dyno comp. Like, it's just jugs.
Duh.
Doesn't matter if my finger's sore. Like, I'm not crimping. I'll just rest after this competition.
Plus, I'm super hardcore. So
yeah, I'll just rest a few days after this comp. My finger will go back to normal. It's fine. It's 22.
Yep.
So I did the dyno comp. First dyno I did, pushed off of the jug. My finger like exploded. It felt like something like a bomb went off in my hand. And I just fell down on the mats and like immediately started crying because I was like, this is it. Like, I can't climb anymore. I'm not going to be able to I was starting to do really well in climbing competitions. I had like just won bouldering nationals, like a competition before that.
Right.
And I was like really excited to start like crushing competitions and like sending hard boulders. And then that happened. So I was like, this is it. Like, my climbing career is over. This seems catastrophic.
Yeah.
And the finger got purple, it got swollen, like it was a bad injury. And then I was like, well, okay, like I think I'll just rest until it doesn't hurt anymore, and then I'll start climbing on it again. So
Right. That's the typical response for
Yeah.
people. I need to rest.
totally, I'll just rest. It makes sense. It's intuitive. Like
Sure.
something hurts, rest. If you get hurt, rest. So I did. I rested for 4 months. It was depressing.
Yeah, that's a lot of rest.
Like literally, I think I was starting to get depressed because I didn't have climbing and I
Sure.
didn't have anything. I wasn't doing anything else.
Sure, your whole identity changes when that happens.
Yeah, especially if you're like at that point in time, I was a professional rock climber. Like that's what I was doing for a living.
Yep.
And I wasn't doing that. And I was worried about losing sponsors. I was worried about missing out on competitions where like that's where I was making money. So, you know, that's all important to the pain experience too.
Yeah. Yeah.
My livelihood is connected to it. So anyway, I rested for 4 months and it didn't change really. It got a little bit less painful. It stopped being swollen, but so there was still something there. So I was like, well, I'll just test it out. Maybe I can like climb on some jugs and maybe it'll be good. And I went into the gym and top roped like a 10A and I was like, oh, it still hurts. I was like, okay, well, I'll just take another 2 months off. Maybe it just needs more time.
Right.
So I took 2 months off and I was so depressed at that point. I haven't climbed in 6 months. Like,
Yep.
I was trying to do yoga. Oh my God.
She says with such disdain.
I was trying to like get into road biking. Those things,
God, that's even worse.
they were fun, but like honestly, like I kind of like road biking a little bit in a masochistic way, but not as much as like rock climbing.
I knew you had issues. I knew it.
But it wasn't, you know, it's not the same as climbing, you know.
Yeah.
So at that point, I was like, you know what? It can't get worse than this. Like nobody knows what to do about this. Doctors say, well, just don't climb. There's nothing surgical about it. There's nothing I can do about it as far as I knew at that point. So I was like, well, screw it. I'm just going to go climb on it because how much worse can this get? Like if I heard it worse, oh well. Like at this point, I would just rather climb. So we went on a climbing trip and I started climbing on it, and I remember like getting on this like a V4 or something and like getting on this like crimp on a V4 and like having to move off of it and being like, oh, I don't know if that's good, because I could like feel the injury, you know. And after that my fingers started healing,
Right.
and this light bulb went off in my head like, oh, you have to use it for it to get better. And so I just started progressively climbing a little bit more, a little bit more, a little more intensity. And then pretty soon I was back to normal again. And it really made me realize, wow, I wasted a whole bunch of time like just resting.
Yep.
And that's not always what you want to do with injuries. And even ones that seem really, really bad or really serious, like resting is almost the last thing you want to do.
Yeah.
Unless something is like fractured or you have, red flag symptoms, resting is the last thing you want to do because it also trains your brain to say like, okay, movement is dangerous. We shouldn't be doing movement.
Right.
And then your pain sensitivity the threshold just gets lower and lower and lower. And a lot of times that's how people get into chronic pain. They avoid movement. Pretty soon they're avoiding sitting in chairs for too long. They avoid. And then that pain sensitivity gets lower. And then things that shouldn't be hurting them start to hurt them.
Sure. It's interesting. It's interesting you brought up breaking femurs actually earlier, because I think when I learned that this graded exposure was important was when I broke my femur, which was in like 4th grade or 5th grade. I broke it in 2 places, trying a backflip on a bicycle.
Oh my God.
Long story, but I didn't. No, I would have, but I didn't. And it broke in 2 places. So there was this floating chunk of femur that they had to put pins in, and I was in traction for a while, and then in a body cast, and then when I could walk on crutches, there was this like very intense, sickening pain when I tried to put weight on that leg. The doctors were telling me the bone is healed. Like, essentially, you can put weight on it. But anytime I would just touch that foot to the floor, it was like, hell no, don't, no, what are you doing, and it took this really, like, at the time, I thought I was like the most mentally strong human. I'm like Bruce Lee over here because I'm gradually putting more and more weight on this broken leg, you know?
Yeah.
And there were doctors telling me, like, you're never going to walk normally anymore.
Oh my gosh.
Because of the way this leg was broken. But ultimately, it was totally fine, you know? But it took this graded exposure that no one helped me into. I just had to figure it out for my, like, you know, 14-year-old self or whatever it was. And I remember these moments in my living room on crutches. Like, my mom would be out of the room and I'm like, okay, now's a good time, because she wouldn't want me to be crying and hurt, you know? And I would try to put weight on it and I would fall down and be crying, and, you know, but I remember going through all this time of doing that, and then relatively quickly, in a couple of weeks, being able to just hobble around on it, you know, with no pain. And I think I learned that then, and that's carried over to climbing, because I've never had an injury really other than a broken bone that's caused me to take time off. It's always been like, okay, I know I can't pull as hard on that. Let's try and pull a little bit. Let's try and pull a little bit more next session, you know? So I've just lucked into that. But as coaches, Nate and I hear from a lot of people, especially being remote coaches, because we're not there in person with them often. We hear from a lot of people who are like, I hurt this, I have to stop this. And the natural go-to, for some ridiculous reason, is I hurt my finger, I can't hangboard anymore. I'm going to climb, but I can't hangboard anymore. And which I don't quite understand. I don't grasp. Other than there's a value system that says climbing is more important. Hangboarding is not that important. Hangboarding is directly on my fingers. That must be what hurts. Right. Climbing is this cool thing that I don't need to be worried about.
Right.
You know?
And they want to do that.
Right.
Yeah.
But in reality, hangboarding is the thing they should be doing, or some sort of loading of their fingers,
that's
whatever
exactly what I have people do with finger injuries. They come in here and they're like, yeah, so what do you think? I'm like, well, there's my hangboard. We're getting on it. And people are like, wait, what?
Yeah.
I have a finger injury. You want me to hangboard? Yes. Yep. And it's also like more measurable than climbing. You know, we know exactly how much weight you're hanging with. We can control exactly the position that you're hanging. Like, it makes total sense. But for whatever reason, culturally, like, same thing with the campus board. Like, ooh, dangerous. People get hurt on that.
Yeah.
So.
Yeah.
One thing that was huge for me, so I blew up my finger this last winter, and we had talked about it. The idea of measurability. Maybe the best investment I've ever made was a 1 1/4 pound plate.
Yeah.
So that I can make just tiny little adjustments to my hangs. And for me, something that was super important was, because it wasn't just this aha moment of like, oh, I have pain. Well, I did this, and now gradual exposure over the course of 30 minutes, it's all gone.
Right.
But one thing that was really huge was I could say, oh, well, I had like a little bit of discomfort, or I had some discomfort at, you know, maybe I was only hanging 11 pounds or something like that off of, I was using like a tension block. And a few weeks later, I'd be like, man, I still have a little bit of discomfort, but maybe now I was hanging 50 pounds or 60 pounds. It's like, okay, like this is clearly an advancement, even though there is some discomfort. And to me, that was a really huge thing, because I guess I had always perceived pain as kind of like an on-off switch. It's like either you're in pain or not.
Right.
Is there anything else you'd like to kind of elaborate on that, as far as like...
Yeah, that's really important. Actually, before I say anything, those were cool posts that you were making on Instagram about your progress with the finger. And I thought that was really cool. I shared those because it's good for people to see that. Like, you were progressively loading your finger, you were graded exposure with the finger. And that's like, you know, you weren't just taking time off and resting, or, you know, doing gentle, easy climbing. You were loading the finger. So those were cool stories that you shared. And it was cool to see your progress too.
Thanks.
But yeah, I forget where I was going with that. What was your question again?
Just the idea of pain being like, it's like either pain is there or it's not.
Right.
Like a
Yeah.
switch.
I mean, that's really important. Like sometimes I have people come in and they're like, well, I'm still in pain. So like, it's not getting better. I'm not getting better. And I'm like, well, when you came and saw me, like you couldn't hang on a hangboard. Now you're hanging on a hangboard with 20 pounds. Yeah, but I still have pain. Yes, but that is progress.
Yeah.
And you're able to do more with the same amount of pain. That's still progress. And of course, we'd like to be able to do more with less pain. And eventually that's going to happen. Like you probably don't have pain in your finger anymore now.
Yeah, and I'd say if anything, like my crimps are stronger now, having gone through all of that.
Yeah, totally. But I think it's an important thing for people to realize that, you know, same thing we were talking about earlier, pain isn't always an indication of damage. And even if you're, you know, and the rehab process isn't always, and recovering from pain and even chronic pain isn't always like a linear process. You may have flare-ups, you know, you may still have pain, but if your function is better, then that's progress. And I think it's important for people to realize that and reframe how they're looking at their rehab or their injury based on that information. And that's also important to the pain process too. If you can reframe. That's one thing that I've done for myself with back pain, and I do with my patients, and you know, a lot of people who are up on the modern pain science, reframing techniques are super important when it comes to pain. So a lot of times people will have like negative beliefs about their pain, or like, well, I'm still in pain, so I'm not better. And that can be, you know, all or nothing thinking. There's all kinds of like they're called cognitive distortions that people can have about pain. And really, like, if you're saying like, oh, I'm in so much pain, I can just never climb again.
Yeah.
Like, is that really real? Like, are you in so much pain that you could never really climb again? No,
It feels that way.
It feels that way sometimes, but I have people who come in, they're like, yeah, I hurt my finger, so I just haven't climbed in 3 weeks. What do you think I should do? And we get them on the hangboard, they're able to do that. And I'm like, well, do you think there is like some grade, some angle, some style of climb that you can get on that's not going to aggravate your pain? And most of the time there is. And they should be doing that. And a lot of times people come in and see me and they're surprised that I'm saying you should climb.
Totally.
Because that's your goal, is to get back to climbing. And the sooner we can have you do that, the better. And we can help them reframe their beliefs. I'm in so much pain, or I'm so injured I can't even climb. Well, that's not exactly true. Like, yes, you're in pain. Yes, there's some things that you can't do, but there's actually a lot you still can do. And that's really important for people to realize, because that's going to help not only mentally with their recovery, but like physically, they're able to still do things that are meaningful for them. They're still able to stress the injured tissues in a way that they're going to be using them climbing or whatever sport that they're doing. So yeah, that's really important for people to realize. Yeah, a lot of people will use like cognitive behavioral therapy to help people in chronic pain, because like reframing your thoughts and beliefs around pain. Beliefs are really, really important. Your expectations and beliefs can absolutely influence your pain and your injury and your recovery process. And like one really good example of that is I read this study where they had patients come in and they hooked them up to an IV. And they told the patients, we're just preparing you for the experiment. We're running some saline into you to get you ready for the experiment. We're going to do a baseline test here. They used lasers to like burn the person's arm. Not actually burn, because you can't do that. But, you know, enough of a hot laser that it was like uncomfortable. Right. You know, it didn't actually burn their skin, but it was painful. You know, so they hooked these people up to the IV. Without them knowing, they actually put them on a drug called remifentanil, which is a drug that is 400 times more powerful than morphine, which I didn't even know something like that existed.
Yeah.
But apparently it does.
That's cool.
So,
where was that when I had my femur?
I don't know if you can actually get this drug, but so they used it in the experiment, and they hooked the patients up to that without them knowing. And they burned them with a laser, and they asked them, okay, we want you to rate your pain on a scale from 0 to 10. How painful was that? And the average answer was 6 out of 10. That was the pain I experienced. And then after that, they said, okay, now we're going to hook the IV up to a very powerful painkiller, and we're going to repeat the test, and then we're going to ask you your pain level. They didn't change anything because they were already on the drug. So they burned their skin again. What was the average answer? 3 out of 10.
Right.
Definitely less pain. Because now they knew they were on a drug that was supposed to block the pain. So, of course, it's less painful. And so then they told them, okay, now we're going to take you off the drug, and we're going to do the same thing again and get another reading. Still didn't change anything. They're still on the drug. Mm-hmm. They burned them again. Guess what the average answer was for the pain level?
Even more.
6 out of 10. Same as the base, same as the first one.
Yep. I saw my grandma, like when she was dealing with cancer and some other things. I would take her to the doctor, and they would ask her what her pain level was, and she'd be totally fine, like acting absolutely normal. And they'd ask her pain, and she'd be like 8 out of 10, right. And I'd be like, I've seen you stub your toe and act way more harmed than you are right now. So
that was an 11.
I know you're full of shit,
Yeah. So like your brain is really powerful, and like powerful enough that we have research that shows it can overcome the effects of a drug that is 400 times more powerful than morphine.
Right.
And that was purely patient expectations and beliefs. They thought they were on a drug. They thought they were off a drug. Mm-hmm. And the answers were different each time.
Yeah. So if they think this is supposed to hurt, or I have this idea in my head that this thing is supposed to hurt it, then that's going to affect things.
And same thing, like if you have a shoulder injury and you go into a climb and you're like, oh, it has a gaston in it, it's going to hurt my shoulder. Well, yeah, like sometimes if you expect that it's going to hurt your shoulder. Like maybe when you were campusing, you sort of expected like, this might hurt my shoulder.
Yeah, this is more ballistic. It's a little more dangerous. This might be problematic.
Yeah, and so it can.
And at the first twinge of it, it probably gets worse every time. So my brain's like, oh no, what are
Panic.
You doing? Yeah, exactly.
Yeah, exactly. And, this isn't like everybody's pain experience is individual. It's different for everybody. Like if there's an acute injury, like, obviously that's a real tissue damage situation. Sure. But the further and further away we get from the time of injury, the less and less it is about actual tissue damage.
Right.
And so when people have like very persistent pain, like it's not always, an actual tissue thing. And we have to talk about, how pain works.
So when there is that moment, like if a client comes to me and says, I hurt my finger climbing today. How, at that moment, it hasn't been 3 months. I can't say, oh, well, that likely not the issue anymore. My general thought is going to be, okay, let's give you a couple days. Then let's start hanging or at least holding weight, whatever it is that we can do. And the language that I use, and I'm curious what you think about this, whether this language makes sense or I'm being too light or I should be a little more aggressive, whatever. I tell people generally to lean into the discomfort, but not go to pain. Mm-hmm. And I've always wondered, like, is telling them not to go to pain making it worse? I'm not sure.
Yeah, sometimes you have to read the person sometimes too. Mm-hmm. Like I will purposely not use that word for some people because it's bad. Pain is bad. I don't want to have pain. What do you mean pain? Push through pain? No. So I'll say discomfort. And I think it's also important to reframe that word and be careful with our language sometimes because pain does have like a negative connotation in most people's mind, which it shouldn't. Pain is normal. It's a normal human experience, and it's actually a good thing that we have pain because there's people who are born that don't experience pain, and typically they die by the time they're 3 because and the ones that don't really live past 24 most of the time. So pain is important. It keeps us safe. But pain does have a negative connotation in our culture.
Right.
And for some people, like I try to not use that language with them. I'll say your discomfort. Discomfort is okay. And sometimes people, they're like, well, now that you explain it, I'm not actually having pain. It just like kind of is uncomfortable or tingly. So I think words are important there too, and it depends on the person. Like if you have someone who's like you're really worried about, I think we shared a client recently, I won't say their name, that likes to push it.
Yeah.
I might say like, don't push into pain.
Yeah.
Because I know you're gonna probably do that.
That person will go 100
yeah.
all the time.
Yeah. So it's individual, and then other people I won't even say that word.
Okay.
And some people I will. Some people I'll say pain is okay. You can have pain. This is fine. If your pain level is back to, if your discomfort goes down to baseline in 24 hours, we are good to go. That's actually a good thing. We want to push into that a little bit. So yeah, I think it's good to tell people to lean into that sometimes.
Okay.
And also get people less afraid of pain.
Yeah. It's something you said when you were talking with Nate a minute ago, I think is really important to kind of highlight and talk a little bit more about. You said it's not this linear thing, that there can be flare-ups, That's totally normal. And one thing I want to make sure that people get is that just because they've felt pain, they've decided that they're hurt, even if they've seen a practitioner and it feels like it's getting better, if something feels like it hurts again, that doesn't necessarily mean you've injured it worse. You're all the way back at the starting point. This, you've ruined the last 3 months of work that you've done.
Right.
That's not the case. Like you've said multiple times, this is really complex and complicated. And we almost have to take I don't even know how to describe it, but it's almost, we just have to say, I don't really know, but I need to wait it out. I need to try a little bit more. And oftentimes, if you start that graded exposure process again, you're going to be right back to where you were in a few sessions. Yep. And be able to continue. Yeah,
absolutely. Like flare-ups happen in the recovery process, and it isn't a big deal sometimes. Sometimes it's just a sensitivity that your body has. It doesn't mean you've re-aggravated it or retorn it or anything like that. And I've experienced that with my back pain before. And I've gone through a few flare-ups. I know exactly how to handle them now. So like one time I was deadlifting, I think I was warming up, I was deadlifting, I got to 275 and I tweaked my back. And I've done it enough times now that I knew not to panic.
Right.
Okay, tweaked my back, this is fine. I didn't pack it up and go home. I took all the weight off the bar and I restarted my warm-up. And I was able to warm up and move past that and get up to 300 pounds that day with zero pain. After a back tweak flare-up.
Yeah. I like that approach of not just pushing through immediately, because my go-to would be, you're not hurt, do it again.
Yeah.
And maybe that's not the best approach when my brain is overpowering my will and taking it back down to warm-up levels and coming back up, a really fast graded exposure, so to speak. Might be the better approach.
Yeah, I mean, it might work for some people to just push through it. Like, oh, it's fine. I'm not actually hurt. And then sometimes that can work. But a lot of times it's just about bringing it down to what you can tolerate and then working back up. And sometimes you can do that in a few sessions. Sometimes you can do it within session.
Yeah.
Like I was just explaining. But that's important. And that's the first thing that I tell people is like, if you have pain, what do? Pain, what do? First of all, don't panic.
Yeah.
Because it might not be serious. Second of all, like there's ways that you can still train if we use that graded exposure approach, or, we back down, like maybe you can't climb on your project with the super tweaky shoulder move right now, but there's stuff you can do.
Yeah.
And it's not always like, okay, well now you have to do V4s because you're hurt. You might be able to do this other V10 that doesn't have that move and be totally fine.
Sure.
So finding something that you can do that doesn't aggravate whatever injury you have. And then also like reframing your thoughts around that injury as well is super, super important. And decreasing like the threat is the most important thing.
Yeah.
And that's a lot of the reason why I have people do like movements and hangboarding and, I'll have people with low back pain come in, we're deadlifting. What?
Right.
We're deadlifting? I just hurt my back. Yeah, we need to show your body that position, that movement, load isn't a threat. And I'm not going to put 300 pounds on the bar and have you pick it up. I might just put a maybe a 10-pound kettlebell on the ground and have you pick it up.
Yeah.
And we start there,
It's really interesting that, like, when it comes to, like, say, falling or trying hard above a bolt or something like that, we can very quickly say, that's irrational. I'm not going to get hurt. And you can, through exposure, convince yourself to take that fall. It's interesting when it's mental like that, we can push through it. When it's physical, we're so sure that we know what's happening. Like, I felt it. It's real. This has to be what's happening, period. We give the brain all this credit when it comes to something more mental like falling, and then we completely strip that credit away when we think we know what's happening in our elbow.
Yeah. And I think we're starting to find out more and more, the more research that gets put out there. They've done baseline studies on, like, they'll do MRIs on people who have no pain, and something like 70% of people with zero back pain have a bulging disc in their lower back. They have no pain.
And labrum tears.
And labrum
for people who have
tears
no
and
pain.
meniscal tears and all these things. And we're starting to find out more and more that, like, these are just like normal signs of aging. It may not actually be like what's causing your pain. And so, the physical, not that the physical doesn't matter at all, because it does, obviously.
Sure.
If you sprain your ankle, okay, you broke your femur, yes, that matters. But it doesn't, for some things, it doesn't matter as much as people think it does, or as much as, like, our culture has put weight on the physical.
Right.
It's not just physical. It's also, it's the physical, it's biological, but it's also, like, psychological. And there's also social components to all of these things.
Sure.
So I think it's easy to, like, rationalize, like, well, I'm, like, safe. I'm on a rope. Like, I'm not really going to get hurt. I'm just being irrational. So we can, like, explain that one away. But, like, oh no, so I actually feel something pinching. I must have a bone spur that's, like, pinching on a tendon that's going to rip.
Right.
Because that's physical. It seems more real or something.
Yeah, totally. Well, I think regardless of whether you're the type of person who thinks this is physical, I know my body, I know what's going on, or not, if you're the person who's like, I don't know, it just feels crazy, I don't like it. I think this graded exposure idea to whatever it is you think hurts, whatever it is you think is injured, try a little bit of it. See what happens. Try a little bit more of it. Try a little bit more of it. And see where that goes. I think, and correct me if I'm wrong or if I'm missing something here entirely, but that seems like a really great tool for self-diagnosis. If it's really bad, go see a practitioner. If you're really nervous about it, go see a practitioner. Whatever it is, if you think you need to see somebody, by all means, go do it. And if you're in the San Francisco area, come to Natasha. But if you're like most climbers trying to self-diagnose and fix yourself, this seems like a really good method.
Yeah, absolutely.
With not a lot of downsides.
Right, yeah. There's that saying, the dosage makes the poison, right? Like, it's not what you're doing, it's how much or the intensity of it that you're doing. So there's always some level that you can scale back to that you can do. and then go from there. And not doing anything is the worst thing that you can do.
Yeah, totally.
And yeah, that's a really good way to approach it. And that's what I try to teach people to do. And I think if people have that tool in their toolbox, they're going to have a lot more, they're going to feel a little more empowered. They're going to feel a little less scared because they can do something about it and they're in control. They're going to have a little more self-efficacy around their injury. And that's really, really important when it comes to pain and when it comes to someone developing chronic pain. Like the less helpless they feel about their situation, the better the prognosis. So,
yeah. And before we wrap this thing up, because we've already been talking an hour, which is crazy.
Oh, wow.
But before we wrap it up, now that we've kind of given people this tool to work through a little bit on their own, how fucking normal is it to feel like you've maybe hurt yourself? I mean, as a former professional climber, as a powerlifter now, as someone who works in a rehab setting with other athletes, how normal is it to feel like there might be something wrong?
Yeah, I mean, it's pretty normal, especially for those of us who train and push ourselves. Like even if you have the perfect program, everybody's different. We're all dynamical systems, chaos. Like we're not robots, and we're not always going to get the dosage right. And, we might feel like something is wrong, and that's okay. There's things that we can do about that. And if you're pushing yourself and you're an athlete and you're competitive or you're trying to get stronger or go harder, like sometimes you just get close to that edge and maybe go over it, and it's okay.
Yeah, I've said to several people over the years that I don't know a single professional climber who doesn't have some sort of tweak, twinge, niggle, something going on that they're concerned about a little bit. And then they go climb the hardest thing ever.
Right. Yeah. I mean,
it's pretty, from what I can tell, it's pretty damn normal for climbers to feel like they've hurt something that ultimately doesn't end up affecting their performance.
Yeah, totally. And sometimes those concerns are legitimate and they have an actual injury, but a lot of times it's just an indication that the dosage is wrong, and the dosage being the volume, the intensity, the frequency.
Yep.
And those are all things that we can adjust. And also, like we talked about earlier, the mental and social side of those things too, stress, all of that. Those are things that we can turn the dial on and affect whether or not we're injured or whether or not we're in pain.
Yeah, totally. Nate, since I've been hoarding the mic over here, is there anything else you have to talk about, ask?
No.
Okay, well, shit, this has been fascinating, and we should do it again.
Yeah.
Next time I'm around or next time you're around. Not that you'll ever be in Lander for any reason, but
you never know.
But we'll find ourselves in the same place at some point in time.
Yeah.
So yeah, let's definitely do it again. And thanks for bringing us beers and sitting down and chatting.
Yeah, absolutely. I listen to your podcast all the time, so it's great to be on it.
I'm psyched that you're on it. Yeah. Thanks, Natasha.
Thanks.
Natasha, again, thank you for taking the time out of your schedule and sitting down. I am really looking forward to the next time that we get to do it, because frankly, there's so much knowledge that Natasha has that I really want to dig into and pick her brain on. And I'm just stoked that there's someone else out there who really wants to continue learning, who is a great resource and provider for climbers. So definitely check her out. You can find links to her website, to her Instagram, right there in the show notes in your pocket supercomputers. And like I said before, one of the things that I appreciate the most about what Natasha does is that she is trying to provide her clients with the tools to honestly not come back to her. And I think that's really massively important. That's something that we are trying to achieve with our Empowered workshops, the first of which is sold out and coming up very soon, just a few weeks down the road, less than 3, I believe. And I think it's important to give people the tools. I mean, there are so many climbers out there that we can't work with everyone. and I want to give people the tools to continue improving. Natasha wants to give people the tools to improve, as well as to improve their experiences with injury and with pain and with rehab. And that's an inevitable part of this sport. So I think it's a huge benefit to the climbing community. All right, like I said in the intro, check out the proven plans. They're all updated as of this Friday, along with some new ones. I'm excited about them. So if you're looking for an inexpensive way to train, we now have them with or without coach communication. And I think these are really, let me rephrase that. I know these are really solid training programs. I've seen them work for hundreds and hundreds of people. So these updates are just making them better. Check those out. Also, if you know a person who has that restaurant experience, is looking to move to a climbing town, Lander, Wyoming, I'm here to tell you, is an amazing one. And there is a general manager opening at the Cowfish. You can find links right there in your show notes on how to apply for that. And I got to get back to work. We've got some really cool and exciting things coming. They're not going to be ready by Christmas. I wish they would be, but we're going to have Christmas in February over here at Power Company. So be on the lookout for that stuff. You know where to find us, powercompanyclimbing.com. You can also find us on the Facebook, the Instagram, the Pinterest at Power Company Climbing. And you can search for us on that Twitter machine. You're not going to find us there because we don't tweet. We scream like eagles.
This time, 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 this time,